In recognition of its social and humanitarian responsibility amid the spread of the COVID-19 pandemic, the Omani Medical Association launched Mu'afa initiative Together for Oman, with the approval of the Minister of Social Development and in coordination with the Minister of Health.
I'm delighted to open this private hospital, the Ad Life Hospital, which is going to be operated by the Oman Medical Association. I'm grateful to all of them for having this very important initiative. In this time where the whole universe is suffering from COVID-19, we have excellent proof in Oman that the private sector has been a very effective partner. And also we have an excellent proof that our healthcare professionals, whether they are in the government, private sector, led by the Oman Medical Association, they prove that they are professionals, that they do care, and they came up with this initiative to run this hospital independently from the Ministry of Health, of course following the instructions, the guidelines of the Ministry of Health.
We are extremely happy to share the hospital with the government authorities during this pandemic crisis. Actually, we were planning to open and operate from March onwards, but because of the crisis we delayed. And anyway, now the government authorities, we have asked the government authorities to take over and manage for this COVID crisis.
And it's always a delight to take the opportunity to thank all healthcare workers and volunteers, wherever they are. They are working around the clock to keep us all safe. But that will not be completed without us cooperating with them. I mean the public, by keeping our social distancing, by following the healthy instructions, by staying at home unless we have to go out for something that's very necessary. So I urge everybody to please continue the physical distancing. The virus is still circulating. The number of cases are still increasing. And the reason for that, lack of adherence of some. The majority are doing an excellent job in adhering to social distancing, but unfortunately it takes one person to circulate and spread the virus in the community.
From the very outset, approximately 40 health volunteers, mostly Omani cadres, volunteered. After 2 weeks, the number of volunteers reached 100 outside their working hours, where planning began for preparing a field hospital.
The decision made by Oman Medical Association that to have a portable hospital at the beginning, but then later we have a fixed hospital who actually was ready here. And we came and had a negotiation with the owner of the hospital, Ad Life Hospital, Dr. Alex, that to occupy this hospital for almost 2 to 3 months for the cases who are diagnosed already and positive for admission. And this is a decision made by the Oman Medical Association and then by volunteers. Almost around 98 to 99% of the volunteers are Omanis.
Ad Life Hospital, which was under the final procedures to be set as a public hospital, was agreed with to reserve it by the Omani Medical Association for the treatment of the COVID-19 cases and took the name of the temporary Oman Medical Association Hospital under the initiative of Mu'afa. The hospital consists of 64 beds, of which 4 beds are for the intensive care unit. The hospital is receiving the confirmed cases with mild to moderate symptoms to be admitted in the hospital according to the international guidelines and protocols. The hospital is the first voluntary hospital for the treatment of epidemics in the region under the full management of the Omani staff.
I am a nurse volunteer through Oman Nursing Association. I have been called here to be a volunteer in this hospital, caring for patients with positive COVID-19, but they are stable and control blood pressure and hypertensive. We received cases from another hospital, Onek and Stadium, and then they will be admitted in the ward. We are here to care for them, to take vital signs, to give medication, and to give the daily care for the patient. And we have to maintain the social distancing at the same time, and we have to protect ourselves through wearing masks, gown, and the PPE precaution.
Medical professional teams have been formed, including specialized teams of nurses, to develop and divide the hospital's medical assistant staff in accordance with international protocols, in addition to quality assurance and patient safety team, as well as infection control team in cooperation with the Directorate General of Private Health Establishment and another hospital, and a medical follow-up team led by a doctor from the Oman Medical Association and volunteers of nurses from Oman Nursing Association. It's indeed great to see this joining force between the private healthcare institutions and healthcare staff representing different areas, making their contribution towards providing healthcare at this time of pandemic. Abdallah bin Ahmed al-Rubaiey, Sultanate of Oman Television, Al-Amerat, Muscat.